Welcome to this brief overview on the Health Insurance Portability and Accountability Act, commonly known as HIPAA. This video is designed to provide you with essential information about HIPAA, its key components, and your role in ensuring compliance. As an employer, it's crucial to ensure that all employees are aware of HIPAA regulations to protect patient privacy and secure health information. HIPAA was enacted in 1996 to safeguard sensitive patient health information from unauthorized access and disclosure. It applies to healthcare providers, health plans, and healthcare clearinghouses, as well as their business associates. Additionally, it includes provisions for the secure electronic exchange of health information to improve the efficiency of the healthcare system. The primary goals of HIPAA are to protect patient privacy, ensure the security of health information, and provide patients with rights over their health information. The top three components of HIPAA are the privacy rule, the security rule, and the breach notification rule. The privacy rule establishes standards for the protection of individually identifiable health information, known as Protected Health Information, or PHI. It governs how PHI can be used and disclosed. The security rule sets standards for safeguarding electronic PHI or ePHI through administrative, physical, and technical safeguards. And the breach notification rule requires covered entities to notify affected individuals, the Department of Health and Human Services, and, in some cases, the media, in the event of a breach of unsecured PHI. PHI includes any information that can identify an individual and relates to their health status, healthcare, or payment for healthcare. Examples include names, addresses, birth dates, social security numbers, and medical records. Protecting PHI is essential to maintaining trust and complying with HIPAA regulations. HIPAA grants patients several rights regarding their health information, including the right to access their health records, request amendments, receive an accounting of disclosures, and request restrictions on certain uses and disclosures. These rights empower patients to take control of their health information and ensure its accuracy and privacy. As employees, it's crucial to understand your specific responsibilities based on your role. This includes knowing how to handle PHI appropriately and ensuring compliance with HIPAA policies. It's essential to stay informed about your employer's practices and procedures for managing HIPAA compliance and cybersecurity protection. Always secure workstations. Use strong passwords. Ensure privacy during conversations, and verify identities before disclosing PHI. These practices help prevent unauthorized access and breaches. HIPAA requires implementing administrative, physical, and technical safeguards to protect ePHI. Employers are responsible for managing their own practices and procedures related to the safeguards. Here are a few examples of best practices around safeguards. Administrative safeguards include security management, workforce security, and awareness and training. Security management includes enacting policies and procedures to prevent, detect, contain, and correct security violations. It also includes risk analysis and risk management strategies. Workforce security is ensuring all members of the workforce have appropriate access to ePHI and preventing those who do not have access from obtaining it. And awareness and training means providing training to all members of the workforce, including management, on security policies and procedures. Physical safeguards include facility access and device and media controls. Facility access is implementing policies and procedures to limit physical access to electronic information systems and the facilities in which they are housed, while also ensuring that properly authorized access is allowed. Device and media controls are policies and procedures that govern the receipt and removal of hardware and electronic media that contain EPHI into and out of a facility, as well as the movement of these items within the facility. This includes disposal, media reuse, accountability, and data backup and storage. Technical safeguards include access control, audit controls, data integrity, person or entity authentication, and transmission security. Access controls are technical policies and procedures for electronic information systems that maintain EPHI to allow access only to those persons or software programs that have been granted access right. Audit controls include hardware, software, and/or procedural mechanisms that record and examine activity in information systems that contain or use EPHI. Data integrity includes policies and procedures to protect EPHI from improper alteration or destruction. This includes mechanisms to authenticate EPHI. Person or entity authentication includes procedures to verify that a person or entity seeking access to EPHI is the one claimed. Transmission security includes technical security measures to guard against unauthorized access to EPHI that is being transmitted over an electronic communications network. This includes integrity controls and encryption. Appropriate administrative, physical, and technical safeguards can help ensure HIPAA compliance. It is important to regularly review and update these security measures periodically to address new threats and vulnerabilities. In the event of a breach, it's essential to act quickly. Work with your employer's privacy and/or security team to ensure how to handle a breach. Non-compliance with HIPAA can result in significant civil and criminal penalties, including fines and imprisonment. It can also damage the organization's reputation and trust with patients. HIPAA is vital for protecting patient privacy and ensuring the security of health information. By understanding and adhering to HIPAA regulations, we uphold the integrity of our healthcare practices. HHS.gov has a ton of great information and resources that cover all things related to HIPAA. Always refer to their website for the latest and greatest information. Thank you for your attention and commitment to HIPAA compliance. Let's work together to protect patient privacy and maintain the highest standards of care.